examinees, all the faculty, all the young, enthusiastic, dynamic intensivists across the world. We are here from 360 Critical Care, and the course that we are dealing with or discussing is TRICS 2. TRICS 2 is Targeted Review of Intensive Care. This is 2, which is for European Diploma of Intensive Care Exam 2. So we have a lot of this type of, you will say, the nomenclature, but this TRICS 2 is specifically for the EDIC 2. Now, I would say, first of all, thank you, all of you. You have joined in big numbers in our last webinar, which was highly attended, and we have also shared the webinar recordings across different platforms, social medias, and there was huge demand for all those that what were the recall questions, and those recall questions would be definitely helpful if you will go through repeatedly, knowing the concepts, knowing the depth of the topic. That would be helpful for the upcoming exam as well. Now, with this, first of all, congratulations that you have made it. The first EDIC part 1 exam you have cleared. So now it is only the part 2. So you have already cleared the first hurdle. And I would say about EDIC part 2. What is EDIC part 2? What are the important things about EDIC part 2 in only one slide? That EDIC part 2 exam is where the oral and the clinical part comes in. Now, clinical part, it would be all online. Oral part, it would be online. It's not like previously where the candidate used to go to the European centers and attend the exam bedside. So it is not right now, at least post COVID. Now, this is all about applying your knowledge in practice, and the format of the test includes clinical scenarios, discussions on the patient management, image interpretation, graphs, curves, data interpretation, communication skills, breaking bad news, everything you do at the bedside. Now, the whole idea is to assess a patient's, the candidate's clinical reasoning, decision making skills, and intensive care capabilities. He or she is going to be the future consultant or attending or the ICU lead in some or other way. So the European examiners are very keen to know how confident, how capable you are to take the lead in your ICU. Now, this is something described as the last step before getting the much coveted EDIC title. And EDIC title is something everybody dreams about, and we all know how people spend their the time just thinking about, yes, I will be getting the EDIC coveted title very soon. Now, some of the dates, important dates for all of you. EDIC Part 2 registration will begin tomorrow only. So today we are having this important high yield domain discussion, and tomorrow you will be eligible at least to apply for the EDIC Part 2 exam. I know it's again another tough battle. That's why I have written that EDIC Part 2 is the last step. Before that, again, one more step between EDIC Part 1 and EDIC Part 2 is getting a seat confirmed to be appearing the exam in the EDIC Part 2 exam. So that's the second battle, I would say. And EDIC Part 2, the next season, autumn 2026 exam is scheduled for November 26, 26. So it's 26, 11, 26. So that you should remember and keep in your the table as a timer. Now, with this, I would say that now it's time to start your preparation. And the last hurdle where most of the candidates, I would say almost like 40 to 50% candidates, they falter despite their extensive and hard work. They do not clear. And that's why I always keep this picture real, that it's not the hard work, rather the smart work that would be definitely helping you in this type of highly competitive and high voltage 3-hour exam, where your total 3 years, 5 years, 7 years of critical care training experience would be tested. So that with that, we are here to help you from 360 Critical Care, and this is the webinar agenda for today. Now we have the successful candidates, 3 candidates we have. We have many candidates who have cleared from our last season, the group, and we have selected 3 candidates because they have actually informed us. I would be very honest with you. first. So 1, 2, 3, and we have selected them that yes, you are the faculty for our upcoming webinar. We never expected the results would be coming before our this webinar. So that's why it was impromptu. We have initially decided not to have any of the successful candidates because the exam result was not out. But again, last minute we have involved. So thank you very much all the trainees come faculties, I would say. Maybe 1 month before they were on the other side of the table. Now they are on the same side of the table that we are all having in this discussion. So I welcome Dr. Aarti Kabra, the critical care consultant from Narayana Hospital, Jaipur, India. Again, she has joined in our TRICS 1 course, again our top course, and also TRICS 2 course, and she has cleared it flamboyantly, I would say. Welcome, Dr. Aarti.
Thank you, sir. Thank you so much.
Now with this, I welcome Dr. again. Very, I would say, he was one of the favorite, and I really know that he would be clearing, and I have already said this with him. Dr. Estaraj Ul Arifin Parasha is the staff physician ICU at National Guards Hospital, Jeddah, Saudi Arabia, and he has been kind enough to accept our invitation just 24 hours before we have approached him, and he agreed, and he has successfully cleared this EDIC 2 exam. Hello, welcome, Dr. Arifin.
Yeah, thank you very much, sir. Thank you very much.
And last but not the least, we have Dr. Riya Malhotra. So there is a spelling mistake. My apology. Dr. Riya Malhotra is the associate consultant at Neurotrauma Unit, Ruby Hall Clinic, Pune, India. Again, her story is also very much I would say interesting, that she joined when she has not cleared any of the critical care high voltage exams, and in due course of time she has cleared all the important critical care exams. So welcome, Dr. Riya Malhotra. She is here. Okay. So with this, I would be welcoming all our faculties. And the first, I would say, he has been very kind to accept our invitation, and he is one of the instrumental faculties across this globe to spread the critical care academics. He is Dr. Ahmad El Masri. He is specialist intensivist and ECLS and ECMO provider, Egypt, founder of PVI Network, founder of PVI Masterclass. He is editor-in-chief of Journal of Mechanical Ventilation. He has almost one page the CV material. So I have just selected few of the important points about his achievements. So welcome, Dr. Ahmad, to our TRICS 2 free introductory webinar.
Thank you, Dr. Tabas. Thank you for your kind invitation and for your kind presentation.
Thank you.
Thank you so much. Shall I start sharing?
I would be just inviting all our remaining faculties, then I will hand over to you. Yeah.
Thank you.
So then I would invite Dr. Jitendra. He's our core faculty, very dynamic and intensivist from Bangalore, Apollo Specialty Hospital, India, and he has been one of the pillar behind our all this critical care preparatory course, EDIC 2. Hello, Dr.
Yes.
Jitendra.
Hi, sir. Hi, Tapas sir. Hi. Hi, everyone.
Thank you, Dr. Jitendra, for joining. And I also welcome Dr. Sanand Kumar Das. He needs no introduction. Very enthusiastic, I would say intensivist, come teacher, come researcher from Australia. And he's the founder and I would say the course director of TRICS 2. Dr. Sanand, good evening.
Good evening. Thank you, Tapas.
Good evening. And last but not the least, the lady power of our TRICS 2 course, Dr. Niharika. Again, I would say she is part of our many of the courses, and she has already given justice to all the courses where she has been. So thank you very much, Dr. Niharika, for joining us.
Thank
we
you,
look
sir.
forward. Yeah.
Thank you, sir. Thank you.
And with this, I would straightforward go to have our this webinar. Before that, one slide about 360 critical care, because there would be many of the attendees who wants to know what is this 360 critical care, what is the nomenclature or name 360, what is this 360. So this 360 critical care online academy is one of the, I would say, most innovative and need of our academy, which believes in preparing today's trainees for tomorrow's critical care. And our approach is 360-degree. So that's why it is 360 critical care, integrating theory, bedside skills, decision making, communications, ethics, and evidence based practice. It's not the hard skills, rather, I would say soft skill also, to ensure holistic readiness, not just exam success. So we do not believe in only exam, but yes, exam is one of the most important thing before we enter into the difficult, like job descriptions. Now our mission to make the future critical care better, safer, and fully prepared.